So without further ado, we're going to go ahead and get started first by outlining the borders on a female patient's abdomen. Generally, the abdomen is broken up into two areas. We have the upper abdomen and the lower abdomen. What we call the epigastrum and the hypogastrum. So first thing I do with the patient is I outline the patient's borders. So I start out by outlining the inframammary area, which is pretty much the area underneath the bra strap. And I clearly take that line all the way to the back. The next thing I do is outline the epigastrum, and you can see clearly here the difference between the two. You have the upper part and the lower part. So generally I just follow the silhouette. She has a wonderful silhouette to follow. So we go here, just kind of go around, and I go around this thing that we call, this is the buccal deformity. Let me get that here. And then I continue onwards, just following the curves very nicely up to this area on the patient. Okay. The next thing I want to do is outline her rib cage. I simply feel for the ribs and outline those ribs. That kind of helps demarcate the area so that I don't. You can see hers very clearly right in that area. So, next step I want to do is I'm just going to mark her left and right side with the marker. The next thing I do is I just show patients that, mark out some areas that I don't usually treat. Some areas like areas of adhesion, such as this buccal deformity here. These are areas that I won't actually treat with this procedure. And finally, I mark out areas that I'm going to feather. I'll make a few more marks here that show the anterior axillary line that help demarcate. And I'm going to go ahead and mark out her posterior axillary line, which is the line and the back, which helps me demarcate the love handles. And here. And one other thing I like to mark out is the inguinal area, so I just kind of bring that all out this way. Start from the inguinal region and bring it all the way out.